Let's bring in our good friend, Dr. Joe. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. He joins us on Wednesdays. Good morning, my friend Joe. How are you?
Hey, good, Ray. How are you doing today?
Excellent, my friend. Excellent.
So I wanted to talk to you today about an injury that springs up around this time of year. We see it like the flowers and the daffodils that are coming up. All of my partners are talking about the different stress fractures that we're seeing in the office today, and I wanted to talk about this injury. It's a little bit confusing, and so a lot of the young athletes that are down at our center and their parents and their coaches, even their athletic trainers sometimes are a little confused about stress fractures. So let's talk about, first of all, what they are. Stress fractures are a hairline-type fracture, an overload fracture of the bone, a fatigue fracture, people call it sometimes in the old days. And when athletes are doing too much, the body starts to break faster than it can heal, and they get these stress fractures. And much of the time it's related to a real rapid increase in volume. So we go from our weather not being very good and everything being going on inside pretty quickly to playing a lot outside. And our spring sports are a pretty short season, so we ramp up pretty quick with a lot of games and a lot of practices. And this occurs in all different sports. So we see it from soccer to basketball. This time of year, of course, we see it in track and lacrosse a lot. And it can be not only doing too much, though, it can also be the mechanics of the way these athletes run or the way they're made. Sometimes they have a flat foot or a high arch or a bow-legged and other things that can lead to these stress fractures. And then in some of our athletes, it can be what we call bone density. They may not be taking in enough vitamin D and calcium particularly, and the bones are not as strong as other athletes. And when they get out and they start doing a lot, they'll have a constant aching pain in one part of the body that's known as a stress fracture. So the diagnosis is kind of difficult. It's usually really localized pain. I ask them to point with one finger to where the pain is, and they will have a really localized area of pain. We tap on that area or bump that area, squeeze that part of the bone, or have them hop on one foot, and they will have a reproduction of their pain, and they say, oh, my gosh, I can't run. I limp when I try to run or do different things sports-wise. And we get suspicious of stress fractures, right? In our clinic, the most common bones that are involved, number one, surprises a lot of people again, is the low back. The smaller bones in the low back when kids are lifting weights or arching their back repetitively or twisting a lot for sport. So gymnastics and dance and kids in the weight room this time of year will get stress fractures in the low back. The hurdlers, the high jumpers, the pole vaulters with arching their back will get a stress fracture in the back, and they'll start having pain all day long. During school, even the activities of daily living are bothering them, and we get suspicious of stress fractures. Often to diagnose them, it's a clinical picture we have. So what we do on examination, we see with the tap test and the bump test that it hurts them. Unfortunately, another confusing part about stress fractures is they often do not show up on a plain film x-ray. And so that's really confusing for parents and athletes is 70 to 70%, 75% of the time, the x-ray can be totally normal. We don't see anything abnormal. And later on, after 4 weeks or 6 weeks or 8 weeks, we will begin to see the body trying to heal that stress fracture. But when they first come in to see us, they may have nothing at all. So we often will start with treatment, but they don't like treatment. And you know that treatment is going to be one of the things that kids hate is that four-letter word rest. We have to put them on the shelf for a while and rest them. we rehabilitate them to try to keep them strong so we can get them back once that bone starts to heal. But if it's really difficult to diagnose and we're just not sure and they're really wanting to try to get out and play, we will have to get an MRI occasionally to diagnose these stress fractures. And then we have a lot better idea of how we treat them because different bones may take longer to heal. So again, back to where I said low back number 1, the shin bone number 2. Many at this time of year runners with shin bone tibial stress fractures. The foot is number 3 in our clinic, so we see foot stress fractures. But we will see them even in the upper extremities, in the elbow or in the shoulder, particularly in growing kids. So these stress fractures in our office are very, very common. And the final point, there's a couple of them that are really bad stress fractures that can be a real bad issue. So most of these heal within a month to 6 weeks if they really follow the protocol of rest and rehab and non-weight bearing, and we'll gradually progress them back to activity. They'll wear a boot if it's in the lower extremity. It's a little harder to keep them off the ones that are in the back. They'll wear a brace or in the arm or the upper extremity. But the ones that really are bad, there's one called the femoral neck in the hip. And when we get a femoral neck stress fracture and they can be at risk to break through all the way, that's a major problem. That's a surgical problem. And so that's one that we really teach our trainers and people. We can't miss the femoral neck, the hip bone. And the other one is in the foot, called a Jones fracture, which doesn't heal well. And then there's one in the shin called the dreaded black line, where instead of seeing healing on the x-ray, we see a black line of not healing. And those 3 are the ones that occasionally need surgery. Luckily, those are not very common compared to the very common ones in the shin bone and the low back. And it's just an extremely common injury this time of year, and it's one that we deal with quite a lot, and there's a lot of confusion and misunderstanding about stress fractures. So I wanted to get the opportunity to touch on it today for our athletes and coaches and parents.
Joe, sometimes we see these stress fractures and really seen it in like running backs, in wide receivers. Well, they'll appear and then sometimes they'll just keep coming back with these athletes. And that was my question. Once you get a stress fracture in the foot, ankle, the toe area, what are the chances of it coming back?
It's fairly high because a lot of our athletes are really pushing us and they're pushing their trainers and coaches, or maybe the people that haven't seen these stress fractures, and they do try to push the envelope of getting back too early, Ray, before the stress fracture is healed, and they will re-injure it. And there's kind of a window of time over the first couple months to heal it. If they don't get it healed, then you hear of them 2 months later, 3 months later having surgery on the bone to have a pin placed or a rod placed in the bone to get it to heal. So you're exactly right. That's very important to know, is if they're trying to rush back too quickly, they're going to have trouble getting it healed, and this happens not infrequently. So it's a delicate diagnosis. It's a very common one at our office. Sports medicine doctors see it a lot. And that's a great question, Ray. I have a quick question for you. Could I ask you, you're my baseball consultant. Could I ask you a quick question?
Most certainly, my friend. Go ahead.
So how did this get by me as a fan of sports and baseball, that on opening day, the commissioner of baseball, Rob Manfred, bought a gift for all the players in MLB? Do you know what that gift is?
No.
It was in their lockers on opening day last week, and I was watching a game yesterday. He bought everybody a Bluetooth headphones so that now there could be communication between catchers and pitchers without having to use signs, and even the infielders and outfielders can have these headphones, Bluetooth headphones, and know where the pitches are going and things. Even the manager in the dugout to the catcher can communicate. They thought maybe it would speed up the game and other things they've looked looked at. But were you aware of, until I saw the Indians relief pitcher come in yesterday, and I saw him fidgeting with a headphone, and this got by me. Did you know that the major leagues went to Bluetooth headphones this year?
I was out on vacation last week, so I'm going to have to play catch up, my friend, and I'm going to dive into this. You got me for once.
It's unbelievable that I got you for once, especially in your sport of baseball. You're my consultant, but I didn't know either. Let's keep an eye on that. I'm interested to see how it'll happen, and if, like the relief pitcher that came in for the Indians, he seemed to struggle with his, so he took it off and they went back to the regular sign. But I did not know this was happening this year, so it's a little known fact, a little factoid about baseball for people watching this weekend on TV. They might look for that new little wrinkle called the Bluetooth headphone that baseball players are wearing.
All right, I'm on it, my friend. Thank you. All right, well, maybe I'll have an answer for you next Wednesday, okay?
Sounds great, Ray. Thanks a lot. Have a great week. Have a great Easter with your family. Thank you.
You too, my friend. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital.